Okay, so we're going to look at the features of the right side of the heart. This would be part of the pulmonary circuit. I'm going to start with the vessels that return blood to the right atrium, and we looked at those earlier in a different module, but you would turn the heart around to the posterior view and find that superior vena cava, and opening up the right atrium, you would look for a very large hole, and I can stick my probe in that superior vena cava like so, and this is one of those hearts that has a superior vena cava not opened up. And then you would look for, below that, you would look for a large hole. That would be where your inferior vena cava, remember, which is parallel to that atrioventricular groove, comes in. And so you can see where that comes into the right side of the heart. This is the opening to the inferior vena cava, and there's a tiny little triangle right below it. That's going to be your opening to your coronary sinus. And if I stick my probe through that, and I'm going to find myself out here in that atrioventricular groove or coronary sulcus again, because that's where that vessel lies, even though you can't see it on the surface. So these are the three vessels returning blood to the right side of the heart, to the right atrium. You've got your superior vena cava, your inferior vena cava, and your coronary sinus. This is the entire right side of the heart opened up. And this heart also has the left side of the heart opened up over here. You want to first take note of how thick that left myocardium is as compared with the right side myocardium. The right side of the heart is only sending blood to the lungs, so it's much less muscular than the left side of the heart, which is sending blood to all of the body parts. We're just going to focus on this right side and look at some things of importance. And first I'm seeing this connective tissue right here with the strings on it. That's one of your heart valves. So you have valves that are called AV valves, atrioventricular valves. This is the valve itself, and it's found between the atria and the ventricles. So AV stands for atrioventricular valve. The one on the right side of the heart that we're looking at here is the right AV valve, also called the tricuspid valve. It's very, very strong. These cords, and if you've ever heard that you have heartstrings, it's true, these are your heartstrings, but they are called cordae tendineae, tendinous cords of the heart. They are attached above to the valve itself, to the AV valve, and below they are attached to a muscular portion of the ventricle called papillary muscle. So papillary muscles attach to the cords, and they play a role in causing these valves to close. Inside the atrium, you can see these muscle bundles in here. This is called pectinate muscle. And so pectinate muscle characterizes the appearance of the inside of the atria. This is the right ventricle. And when you look near the apex, you see kind of an arrangement of muscle down here near the apex. It looks kind of spongy, like spongy bone. And this is called trabeculae carni, which literally means spongy flesh. So the arrangement of the muscle down here near the apex that characterizes the inside of the ventricles is called trabeculae carni. All right, the final feature associated with the right side of the heart is going to be the pulmonary trunk and the pulmonary semilunar valve. So as you're looking at the surface of the heart here, remember that the right ventricle lies over here, and it's pushing blood up into that pulmonary trunk, and this pulmonary trunk has been opened up, and portion of the right ventricle has also been opened up. So I'm going to open this, and I see at the base of the pulmonary trunk there are these little pockets right here. These little pockets are the pulmonary semilunar valves. Someone thinks they look like half moons, so hence the name. And you've got three of them, and you know, the one has been sliced through because we've opened it up. But this is the pulmonary semilunar valve. When the pressure changes as the ventricles relax, blood's going to want to flow backwards, and it gets caught in these pockets, so they prevent blood from backflowing. difference between right side and left side here, you can see again, thinner wall, right ventricle, thicker wall, left. And between the two, there's a shared wall. This structure here is called the interventricular septum. It's a very important part of the heart that has specialized cells that are found here that cause the heart to contract. Okay, I'm going to show you moderator bands. These are modifications that are only found in the right ventricle. Moderator bands help reinforce the wall of the heart.
I'll show you two examples of moderator bands. In this calf heart, you see a small moderator band running transversely across the right ventricle. In other calf hearts, you may see much larger moderator bands, such as this one seen here.